Okay, it's 1 o'clock. We'll go ahead and call the meeting to order. We'll start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Pray. Fathers, come before you again. Thank you for your blessings on us. Here from this county, thank you for all the good things you've given us, Lord, and for Mr. Chief Nicholas Wilson today, and help us to serve you as you will. Help us hear you and us. Pray the Lord is getting in mind. Help us have the knowledge to yield will. Keep this in.
Amen. Thank you, Mr. Pollock. Amen. Been upstairs with the judge.
Okay.
I thought, according to my watch, I thought it was 3 minutes to one. Time is
It's just fine.
1:01.
It's just fine. So the first thing we have on our agenda is county personnel or public comment. One,
No exec session today. He's not gonna.
Okay.
Right.
All right.
hi there.
I'll be quick.
I want to talk about things.
So I met with Jerry this morning. We went kind of compared notes, went over some stuff. I'm gonna go around again this afternoon and look at some spots that he had marked down. He's gonna look at some of the stuff that I had to kind of see how much damage it is. We found some stuff out Hatton Township, some culverts and stuff this morning that I went and looked at that were pretty bad. So we're just kind of making notes so we're ready if this does get declared. They'll set an RSM team up here. And we'll have to take them around and show them some of the stuff. We kind of want to be ahead of the game if they come up here. So we're not having to drive every road to try to find stuff. So we're just kind of going around comparing notes, and I've got a lot of stuff wrote down. He's got a lot of stuff wrote down. So Joan's still sending me some stuff Friday with some pictures and different things. So I think it's kind of some of these farmers and stuff are mowing roadsides and things, we're being able to see a little more of the culverts and different things that are going on. So we'll probably find more by the time it comes around. But
Okay.
the good thing is when this team comes up, that's kind of what they do is go around and evaluate with us again. So that first one was just the initial estimate kind of deal.
I drove, having drive through King City, Missouri over the weekend, and there was a company, and I got the name, I figured out, they had two of those trucks with the booms on them.
Booms.
Yeah, just outside of St. Joe. I mean,
Yeah, picking stuff up.
Yeah. well, this was, they weren't actually working. They were just like a construction
Oh.
business, and they had two of them parked side by side. And I thought,
Yeah.
do we need to try to seek things like that out?
Well, we got the one here in Hiawatha, and I met with him 2 weeks ago and took him around and stuff. He can bring another truck up.
Okay.
He's in somewhere in Missouri too.
Okay.
So yeah, Bethany maybe. So
Okay.
this rain that we had 2 Fridays ago, the 3-inch deal, it's amazing how much it washed stuff down. Like Jerry and we noticed this morning, we were talking with, there's a lot of that just, it's gone now. So just, I guess it was
Flushed it.
yeah, 3 inches in an hour, that just kind of pushed it down. But that's kind of right through Hiawatha, this area, like up north only had 1.5 inches. South was less. Yeah, about an inch. So you didn't have that kind of wash in some of those places. So, but that's all stuff that we're gonna look at for that debris pile. And it's gonna depend on from that team, how far down the stream they go from the bridge or culvert. Some of us said 200 feet. Some of them said they might go further depending on how much they see down there. So they make that decision.
Okay.
As far as cleanup, and they know that a lot of that we're not gonna be able to get in there till after harvest anyway, because we're gonna be driving through
Okay.
fields of cornfields to get down there and clean the ditches up.
Okay.
So.
Brandon, one thing that I've talked to Jerry about was utilizing you. Basically exactly what you're describing, but utilizing you more to do that, to help out.
Yeah,
But then also, I've been asking him for a kind of an idea, if there's projects out there, because the guys feel like they're behind because of the storm, that makes sense. But if there's projects out there that we could hire some local guys to get that done and purged from the system, we're obviously turning in and hoping we receive some money. It doesn't mean we do.
Yeah.
But to me, it seems like if we actually have invoices from companies and it's actual storm damage and you can document that these crews are doing this, it was part of our list, it's gonna help the road guys get kind of back to where they can get back to their normal jobs.
Yeah.
But it seems like a good opportunity to be able to document properly what it's taking to get some of this stuff done.
Yeah.
Will you just check with him again and just make sure that he's doing that? 'Cause
Yeah, and that's kind of what we did with Tammy this morning. Me and Jerry and Tammy this morning was kind of marked down some of that stuff. And he keeps pretty good track of what they're doing day to day, so that's kind of why our list is good, because we can go back and say, well, on that day, he worked on this. One that was on both of our list as far as, you know, and I've got over 100 and some pictures. Plus with FEMA was here, they took a lot, and theirs actually marks exactly where they took the picture. They got an app that tells them exactly where they were standing when they took the picture, so. But yeah, that's something we were talking about this morning, just making sure we keep track of what locations they've already done some of that stuff too.
Yeah.
They said they had 2 of them, that was quite a bit of work they done in 2 or 3 days last week, so we're gonna make sure we know where that area is.
Well, the calls keep coming in and people keep saying, you know, can we get this or can we get that? And I keep telling everybody I talk to, hey, the guys are prioritizing the, you know, the things. There was a hole that showed up on the Baker Road the other day, right in the middle of the, or right in the travel lane of the road that's undermining. And obviously that takes precedence. Now you've got a hole in the road, we better go see what's gonna go on.
Yeah.
So they keep getting pulled off.
around.
And the maintenance that needs to be done this summer still needs to be done.
Yeah, so they're still hot patching and all that kind of stuff.
Yeah, and a lot of tubes that are plugged and
Yeah.
things like that.
Yeah, so we're gonna try to, you know, so one of my next things on here is I'm in Manhattan all day tomorrow for our region meeting, which we have one every month. I didn't get to go in June because of the flooding, so I didn't go to that one, but this one's in Manhattan tomorrow. So I'll be down there most of the day tomorrow for that. And there's gonna be a couple guys there from state that are gonna kind of give us an update on how all this works, because Jackson County and all them are there, they're all in our same region, so. They were there talking to their stuff, you know, the week before and last week, so kind of doing the same thing they did with us up here with state and FEMA. So hopefully get somewhat of an update tomorrow on that, kind of how it's moving along and where we're at, so.
Did you get a response on your sticker request, like what people thought looked best?
Yeah, a little bit. That was my next thing, was just see what you guys think on those decals. That's something that the state, you know, they want emergency management vehicles to kind of be. And I see their point. If we do have to get called out to another county, they kind of want to know who we are. We're not just going in an unmarked car. You know.
Yep.
So, I think it was less than $500 to get a decal. We'll just get the emergency management put on the side with Brown County. So, if you guys are good with it, I says he's gone all this week, so it'll be probably a couple weeks before he do it anyway. So, but
you have.
I liked the second one also. I think it looked,
yeah, it's a little cleaner. It's not so big. The other one was, I think, too much. So, yeah. Were you able to open it?
I didn't see where it was at,
Email.
Sent it.
just today's.
No, I sent it last Tuesday or Wednesday, I think.
but she resent it again, came back.
I just sent yours today.
I couldn't open it at first and then you sent it and there was 2 of them there. I responded that I liked the second. best
Yeah.
also.
Went to one of the truck line. Yeah.
Yeah, so
Yeah, it was from MERS, like a Ford from MERS Inc.
my response was whatever you think is the best.
Yeah.
Yeah, okay.
Yeah.
There you go.
Yeah, yeah, kind of going with that one. It's a little more cleaner. I thought that it, you know, I'm not trying to go put all kinds of stuff on there. We just kind of wanted something on there. So, I know the old Ford truck just had emergency management on the tailgate or something.
So
This
you
one's
keep
never
us
had
up to
it.
date too, you know, on the mileage and everything on that pickup, right?
Yeah.
You're running up the road.
Oh, yeah. Yeah. And I just write down every time, you know, as far as keep track of anything I have service.
It had like 130,000 or so.
Like 127. It's got like 131 or something
Okay.
now. Yeah. So, the other deal is, emergency management Facebook page. Most of the counties have it. Donovan or Nemaha always really was good at posting stuff on there. I'm not a Facebook person, but I asked Dallas about this when we got in here. I would have to get a Facebook page to kind of administrate that page. So And I'm fine with that, if you guys are good with that, I'd like to have it just to kind of post, weekly forecast or, the weather's gonna get bad that afternoon, kind of give people a heads up. Seems like everybody uses Facebook now, so I'd like to just be able to kind of post stuff every once in a while from emergency management side.
Okay.
Instead of trying to put it on the county website, just,
So just for fun, Raymond, and we're 6 months ahead, like the burn schedule, things like that.
Yeah.
Could we implement that?
oh yeah, that all can be put on there.
You kind of have that in the back of your mind too,
Okay.
you know, what
What we're
we
gonna
need
do
to
there.
fix that. Yeah, I had a couple firefighters, ask me at the fair about the corner, that's not fair. They just asked me
Ask
about
about it.
the burning, so.
Yeah, and we're gonna bring it up the next fire chief we can do, so kind of get everybody's ideas.
Okay.
And I kind of put it out there for all of them to think about it for the next month or two, and then we can sit down and take one, see what everybody thinks. So yeah, if you guys are good with that, I'll probably go ahead and try to get that done here within the next couple of weeks, maybe try to get this page going, so. The nice thing is what the state sends out will come straight to me, and then I can just share, forward it on, put it on there. I'll have somebody show me how to do all that Facebook stuff.
I bet you Nikki would love to do that because she's really good at Facebook.
Yeah, so, and the next thing is just to check about, so the KEMA conference, which is Kansas Emergency Management Association's conference, is August 31st through September 2nd in Manhattan. I don't know if Dawn ever went to that, but it's something that I would like to go to. I think it's, especially just coming in, just to kind of be there, it's a 2-day conference. The first day is kind of our region gets together and goes over a lot of stuff. And then the next 2 days is more of a conference thing, which is all the new stuff out there, pretty much. Different softwares, different things that are out there for management. So
If it's in your budget, annual conference?
yeah, annual conference. So yeah, so I'll probably stay down there a couple days.
That's what yours in
26. It's this year.
Yeah, it should be. I think it was in there, I think, as conference, but yeah, I just wanted to kind of give you a heads up, make sure that's. I'm good to go to that, and yeah, I think it'll be a good one to go to, so. I want to start trying to get into some of these classes, so I was. Kind of wanting to go to these, thing tomorrow, and then probably that deal, and then start probably classes right after that, because. I don't want to just jump right into another class until I kind of. We've seen my first couple months, it's just been. Thrown right in, so really hasn't been a whole lot of time to get on any of that stuff yet. I still haven't got to go down and meet with the state yet, but sit down with JD and really kind of get a game plan of, the first year what I should really get done. So it hasn't worked out. I think 3 different times we've tried to meet up and that hasn't worked, so. But he's gonna be there tomorrow, so I'll get to talk to him real quick tomorrow. But that's all I got. I just kind of want to run those things by you real quick, and as soon as I got more info on this.
So you've been doing this for a couple months now. You got trial by fire. We had this storm come through, which probably made your job at least exciting.
For a little bit, yeah.
For a little bit.
Yeah.
Is there things that you thought about that would make your job better, or would make you be able to do your job better if you had equipment? Radios, just stuff like that. Have you come across anything like that?
Not really equipment rise yet, no. I am still looking for one of the radios, 800 radios. I thought he had one. I don't know if he turned it in or.
So how does that, with the 800 radio, do you have to be law enforcement? Okay,
No,
you don't have.
no,
to.
fire EMS, everybody has one.
Okay,
So, and there's a charger in my truck, so at some point it's there, but, so I talked to John a couple times. We think that's the ones that are down there, possibly. They were set aside for somewhere, but I haven't heard back from John who they were set aside for.
So
John
right-
gave them to him when he left.
right now, let's just say there was a fire that started burning and local departments were responding. You can't communicate to those departments right now unless you call them, right?
I can so I don't have a portable 800, I have an 800 radio in the truck.
Okay, and it's working
And a high-
fine?
Yes, so I can talk to everybody in that. That's the one we had to take KHP 1 and 2 off, because I couldn't have that, because I'm not on.
Because that's the law
So
enforcement.
I took it to St. Joe, had those 2 taken out. I have everything else, so. Yeah, so I mean, I can still talk to everybody on that, I just don't have a portable, but. For the most part. I've got my high band that's for EMS, so I can talk to people on that.
Okay.
So, but we're gonna find 800, we'll figure it out, I mean, there's something out there.
Do you know what an 800 radio costs
Oh, the new ones are about $4,500. Yeah,
for a mobile one? Wow.
yeah, they're not cheap, yeah. Right, I mean, it's gonna be hard for some of these departments to be able to get them, I think, it's a lot of money. Yeah. You know, and then talking Midwest, some of these, they're talking about upgrading on these things probably within the next 2 to 3 years. So it'd be $500,000 easily to get these all upgraded, so it's like,
No, well, we just went through that with the sheriff's department,
yeah.
so.
Mhm. So. Yeah, so it's, I'll get one found, I mean, we'll figure it out, so. I have not, I think it talked to John last week and see if we got a hold of Dawn to find out exactly where those were placed to, but we'll get it figured out.
Okay,
Yep. But. All righty, that's all I got.
Can you stick around for a little bit?
Yeah.
Can you give us, we need about 2 minutes, the commissioners here to talk, and I'll call you back in and go to the next session. So right now, I want to make a motion for executive session to discuss non-elected personnel and duties with just the 3 commissioners, and I only need about 3 minutes. So is there a second? Second. Okay, it's been moved and seconded. All in favor, say aye. 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 All right. Okay, motion carried. 3 minutes. And then. out of executive session back into regular with no binding action taken. I will call for another executive session, non-elected personnel, and in the interest of keeping our schedule, we'll go 8 minutes with the 3 commissioners, the county clerk, and our emergency manager, Brandon Roberts. Is there a second?
Second.
Okay, moved and seconded. All in favor, say aye. 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 Okay, motion carried. 8 minutes should put us about 1:29. All right, we're out of executive session, back into regular, no binding action taken. We have a 1:30 Zoom, but we'll just roll on, do what we can do. Let's see the minutes from the 13th of July. Are there any additions, corrections, or comments to the minutes as presented?
Yeah. Where it says the approved minutes from the meeting before.
Okay. Yeah,
Which got there.
July, and you got a June instead of July. Okay. All right, so we're gonna change June to July. Anything else?
On the minutes, I think.
Okay, well, if that's the only correction, is there a motion to accept them as amended?
We'll make a motion to accept the minutes as amended.
Okay, is there a second?
Second.
Moved and seconded, all in favor, say aye.
Aye.
Aye. Right. Okay, motion passed, minutes. We're good. All right, here's our Zoom call at 1:30. Can you hear us?
We can, yes. Good afternoon.
Wonderful, welcome.
Thank you. We appreciate you taking the time to visit with us today. We thought it might be helpful for us to regroup and kind of give you some updates on financial performance as well as what we've been working on your behalf since we last visited. And so I'm not sure if you got the presentation materials in advance. We just sent those over on Friday, but we were going to plan to share our screen so we can walk through some of those pages together as well. But before we do that, is there anything else that would be helpful for us to discuss today while we have time together?
I don't think there is. I did have a chance to look at what you sent over, so we've had it.
Yeah,
since
we have it.
So.
Okay, perfect. Well, some of the first couple pages kind of highlight some things we talked about in our last meeting. So I think I'll go ahead and pull up our presentation here, and it might make sense for us to go ahead and start with the financials. And then, of course, by all means, we can hop around if there's other things that you all would like to focus on. But this is page 6 here that I have shown on the screen. Can you see that on your end?
Yes.
Okay, perfect. So we do, Greg and I review your claims utilization on a monthly basis, and that is something that's available to you as well through Blue Cross's online system. But monthly, we do pull your reporting so that we can get a feel for how your claims are running. And so this is what's summarized in their report, including claims data through June. So right now, what we're looking at is you have claims that are applied to the aggregate stop loss level. That's for claims that are below 50,000, which is the stop loss level that we have applied for Brown County. And so essentially the county is responsible for all claims up to 50,000 for each plan participant on the health plan. And so that's what's reflected in this applied to ASL column is for each month in 2026, how many claims that you all have paid for your plan. That is then compared to your attachment point, which is your maximum claim liability that Blue Cross sets for you. You do have a monthly cap essentially. So this is a cumulative total here at the bottom for June. So what we're looking at is for the first quarter of or first half of the year, we have had $309,000 in claims compared to your liability of $457,000. So your loss ratio is 68%, which is running well at this time. We always preface that towards the end of the year, claims tend to deteriorate some, and the plan ends up taking on more liability as individuals hit their out-of-pocket responsibilities. But at least from this standpoint, the first 6 months, we are running well. We would consider anything below 80, 85% to be running well. Here on the right-hand side, we've also looked at a year over year what your large claims have looked like. So your large claims are what are claimants above 50,000, that stop loss level. So in 2024, we did have a poor claims year where we had 4 individuals on your plan exceed 50,000. Anytime claims exceed that 50,000, Blue Cross takes on that liability. So they do consider that when looking at, renewal as in 255,000 above 50,000 they paid for in 2024. We did have much less in 2025, which 77,000. And then this year we've only had 1 individual hit the 50,000 stop loss level. And I did look at your utilization reporting, and that individual actually has termed off of your plan as well. So there would not be ongoing costs from that particular member for the balance of the year. Any questions on that? As I know it's a lot of information and numbers at once.
We have passed away.
So H1 means half year?
Yes, exactly. The first half of the year.
Okay. And so that 255,000, that's total for all 4 claimants in 24.
Yes, it is.
Why is it the rest of them? Okay.
So it's very positive to see that number has trended down year over year. Hopefully it continues that way. So then next we did look at the utilization of your plan. So what are individuals on your health plan using it for, as well as what are the areas maybe of concern. So you'll see here that your pharmacy per member per month costs are, plan paid costs are $210. So that is the area of concern, as where we're seeing your claims driving up is on the pharmacy side. Blue Cross's book of business, their benchmark is $159 per member per month. So you're 32% above that benchmark. And also your pharmacy share of your total plan spend is 36%. Now, we will say that that's not out of the norm. We do have several employers that we support, as well as what we hear in the market, that pharmacy spend is the key driver. And a lot of companies do have a benchmark that's higher than what Blue Cross is showing for their entire book of business. Now, where we're seeing your pharmacy spend going is primarily on these diabetic therapies. So we do have 9 members total that are taking these 3 prescriptions that are all for diabetic therapy. And so it shows you for 2026, what those costs have totaled is almost 47,000 just for 9 members to obtain those medications.
On the one chart that shows preventative care, and there's 23, is that a good ratio based off of, I mean, it's almost half of the, are we still around 60 participants? Is that correct?
Yes, that is correct. And of your cost drivers, we would actually, that's positive. We want individuals to be getting their screenings done and staying on top of vaccines or what have you for preventive care and catching things early. So the higher that number is, even cost-wise, is a positive to see.
So Blue Cross would look at that number. If you have a high percentage in preventative care, that'd be a good indicator for them, correct?
Exactly, yes. So we definitely like to see that in the top 5, if not the top 3 categories for your cost drivers. But as you can see, same with the pharmacy, that we're seeing a lot of diagnoses towards the type 2 diabetes, musculoskeletal, which can come with an older population. I think your average age on the plan is 48. And then we have autoimmune and skin conditions as well. So on this next page, we wanted to talk again about funding versus your claims. We know it's important with the county that you have a set budget, as there's, several other things that you all are trying to juggle and allocate costs for on a regular basis. So we wanted to put together, again, your budget that was adopted compared to what we project the claims will be for the current year, and just put together an illustration for you all to consider. So with the 2025 plan year, we did end up carrying forward a balance of $114,000. And so anytime you carry forward a surplus, that's up to you all to determine how you want to use those funds. And that could be keeping it as a reserve for those high claims that come through. It could be offsetting costs for you all and allocating it to something else, or even changing up your contribution strategy. So that's why we like to point out the surplus. And so we've done the same thing in projecting what your 2026 surplus might be, as we've taken your adopted budget, which is calculated based on your fixed cost, your variable claims. So every self-funded plan has a fixed cost that you pay. That's for the administration of your plan to Blue Cross, and your protection for large claims, and then your variable claims cost. So again, you only pay that $844,000 if your claims run up to that level. But then your budget, I believe that you all set for 2026 that we have on file is the 1.365 here. And so then what we've done is we've taken the fixed cost, kept that the same, and then we projected based on how your claims have run in the first 6 months. We've determined that we project your claims to be about $742,000 for 2026. So that gets you to this 1.2. We also wanted to point out Blue Cross's projection, because they always give you an estimate on where they expect your claims to be, or expected cost to be for your plan, as well as your maximum liability. So they expected your claims and your fixed cost to total this 1.385. Your maximum liability is 1.5. And so what we've done is we've projected a 5% increase to your budget. And so we took the 1.3, added 5% to get the 1.4. But essentially then you can use RX rebates, which we project to be 80,000. That's just based on history that you can use to offset your cost as well. And then the 251,000 surplus, what we're doing there is we're taking the difference between your budget and then this 1.433. That's how we get the 251. This 1.2, because that's where we project you will land based on how claims are running compared to that 1.43. So all in all, you're having a carry forward from last year. We're expecting to carry forward from this year. And the reason we bring that up is, it just positions you in a favorable position with Blue Cross and your self-funded plan based on how claims are running year to date.
So is Blue Cross, when they're projecting the last part of the year higher than what you projected, they just use a different multiplier? But is it because, like you said, typically people tend to use the health insurance more towards the end of the year after they've hit their deductible? Is that correct?
Yes, and they do have a formula for how they come up with the cost, and it also can change based on enrollment in the plan. So you can see that your maximum claim liability can fluctuate actually, but throughout the year as enrollment in the plan changes. And so that's another reason why we monitor your claims month to month, is that maximum liability is kind of a moving target. With you all, you seem to stay pretty much the same and don't have a lot of change in your enrollment. But it is good to note that number can change if you have a large swing in enrollment.
Yeah, so just the only thing that I would add as additional insight to that question, that 1.433, that's expected claims, that's just purely a reflection of the renewal that we got last year. What we're projecting the claims to be this year is based off where the claims have been over the last 6 months. Now that may or may not come through. It's kind of one of those things. The claims typically pick up in the second half of the year, but the other side of that is there's also that stop loss level that kicks in. So when the stop loss level kicks in for any large claims above the specific stop loss level, so that kind of acts as a buffer. But we are looking, I mean, thankfully, we are looking at a pretty good surplus based off the way the claims have been running, and then we know we do have a surplus as well that carried over from last year. So, I mean, really, I think this year, I mean, we've got a lot of clients that claims are popping up. It's nice to see that yours expected is 80% and your claims are running at 68. So that's a very positive thing.
Mhm. So essentially, our recommendation, looking at budget increase for 2027 is what we've illustrated here as a 5% to, absorb, what we may get on the renewal increase. That won't come until the 1st of October. But again, you can keep in mind the carry forward surplus, the current year's surplus, as well as the rebates that you all get back on your self-funded plan. So these next couple pages talk about, some strategies, things that we've talked about in the past that we just want to also bring forward again as things that you can consider. It does show, what would present higher or lower cost savings, as well as higher or lower member disruption. As we talked about, the pharmacy is a large piece of where your costs are going. And so one of the things that we've evaluated in the past is Blue Cross's alternative formulary. So currently you all have Select formulary, and that is an open formulary, meaning that just more drugs are accepted through the plan, whereas Results RX has a closed formulary, and essentially they do exclude some drugs, or they promote other therapeutic alternatives that are same quality but of a cheaper cost to the plan. And so when we evaluated that option last, it presented a savings of $6,438 in savings against $7,664 in paid claims that you had. And so that's just something we wanted to bring forward again. That's something you can do within your current Blue Cross bundled arrangement. Is considered the alternate formulary, and we can always have an updated disruption analysis run with your renewal to see if there's been any changes. But this is something that we're seeing become more of the norm. All of Blue Cross's fully insured business has to have the Results RX formulary. It's really just the self-funded groups like yourselves that have the option of staying with Select or moving to Results RX. And then all of Blue Cross's new business business that they take on is being written with the Results RX formulary. In addition, in the marketplace outside of Blue Cross, a closed formulary is the norm. It helps in mitigating costs. If there are other options available, it's a way to present savings to the plan by promoting those cheaper alternatives. And just where we're seeing a lot of your costs be towards the GLP-1 medications, as this states, the demand for those medications are likely to accelerate, especially now that there's going to be an oral alternatives available and just more of those drugs coming to market. So making a change to a closed formulary is something that we think would be worth considering. The other item we talked about in the past that I'd like to bring up again is, as we continue to see diabetes management being something that's important, especially when you do have a lot of your utilization being for those that are type 2 diabetics. Blue Cross has this program that you all enrolled in as a self-funded employer called Virta. And last time we talked, there were 17 individuals eligible for this program, just based on claim identification. And there weren't anyone engaged in the program. The type 2 diabetes reversal program helps individuals get in contact with a nurse and be able to monitor their condition more proactively, help make sure they understand their condition, and also provide ways to hopefully have a better lifestyle. So it is something where we think if you could better promote the program internally or at open enrollment, that would be a focus of ours to talk to the employees as a whole. We wouldn't pinpoint certain individuals. We would certainly talk to everybody as a whole about the program offering. That way it's something that they can consider being a part of.
You said that's called Virta?
Yes, it is Virta.
Is that an acronym or is it just the name?
Just the name.
Yeah.
And so that's basically right along the same line as preventative care.
Well, except these individuals already have type 2 diabetes. So
Right.
rather than, getting screened for something and try and prevent something from happening, they're already there. But yes, it is something where they can try and help improve their condition, better manage it.
Right. Yeah, I understand the difference between that, but I'm saying it's if we would do a better job on promoting preventative care and then plans like Virta, then maybe long-term our employees would be a little healthier, I guess.
Yes.
Work it out.
Yes, that would be the hope. Mhm.
So that's a tough subject because we can't mandate that people do this.
Right.
But like you said, so you offer it across the board. We wouldn't be picking out an individual and saying, hey, we want you to talk to them about Virta.
Right. We've done employee meetings in the past during open enrollment. And so it would be something that we would just have as a talking point.
Have you used it? Has that been used other places successfully or not? Are we behind the game on this, or are other counties doing better or companies doing better?
Yeah, we do have other groups we support with Blue Cross that have Virta activated. Not all of them do, because again, it's an option for self-funded employers. So you all chose to elect that as an offering for your employees or your plan participants. But yes, we do find that coupling Blue Cross's correspondence with internal correspondence helps drive participation.
Okay.
One other question, I don't know if you get to it or not, but in the news a while back, it said that America's drug prices were a lot higher than some other countries, and that the government was working on getting those prices lowered. Has that happened, or is that just news talk?
Are you talking about like international sourcing or Greg,
Uh,
maybe, I don't know if you better understood the
It's
question.
dealing with the drug companies, I think that how they price it in different places. They were pricing it higher in America than they were in Europe with stuff. Not, I don't know that pertains to anything, but if the drug prices would come down significantly, it would surely help, but it's just a question. I don't know if you heard, if that's happened or.
Yeah, I mean, you know what I would say to that is, I mean, we are getting pretty much throughout our book of business, prescription claims are just up. So there's lots of different strategies. And frankly, this one that Jess outlined to you with Blue Cross on changing the formulary would be something that we really need to consider at the renewal because it provides, I mean, first of all, the doctors are all aware of the formulary anyway, because all their fully insured block of business is on the results formulary, which makes more sense for us to do. There would be some trade-off, but I think long run, that's low-hanging fruit for helping you control your cost without dramatically impacting the quality of the benefit program. If you wanted to look at, I mean, some of the things that the legislation have done to impact lower drug cost, for example, on the GLP-1s, that's more a to the consumer benefit than it is a group benefit because it's for individuals and it doesn't apply in group plans. But there are some other things that the administration has done to impact drug cost in a very positive way. And there are some things with some of the diabetic drugs. There's been some cost incentives and some modifications and negotiations of prices that have flowed through to our customers. You know, the other thing, and I know we're going to get into this, and I guess I don't want to steal too much of it, so I'll just let you. I'll stop for right there and go ahead and go to lever 3, Jess, if you don't mind.
Thank you.
Go ahead.
I'm done. Thank you.
Before you do that, Greg.
Yep.
So you kind of hit on something I was thinking about too. So yeah, there have been programs that the consumer can go direct and get better prices on these
Yeah.
GLPs, like the Trump
Yeah.
X thing that he rolled out.
Yeah, the
So-
GLP-1, yeah.
In your opinion, because this is how you make your living, are the indicators that prescription drug prices for insureds, you know, counties like us that have an insurance program, are the indicators that they'll level or possibly go down, or do you see it just continually going up? Because you had mentioned when you were here before that when you look at Brown County as a whole, one of the reasons our prices are the way they are is because we have a higher usage on the pharmaceuticals as a percentage wise.
Yeah.
And so I guess what I'm trying to get from you is, do you think it's going to get a little better in the future, or do you think it's getting worse?
Yeah, I mean, all the indications are within the meetings that we go to and the industry that we are a student of and have worked in for a long time, is that prescription prices are going to continue to go up. And the reason they are, I mean, I'm not going to tell you otherwise, is because of the technology and the drugs and the fact that we've got people, you know, we've got some people that are utilizing some pretty significant expensive drugs, and we don't even have a lot of specialty drugs out there within your group. So it would be unrealistic for me to tell you that prescription costs are going to stabilize when the industry is showing that they're not.
Okay, fair enough.
So I think the real question is, you say, and this is something that we're always measuring on a regular basis, and I know we're going to get into this in a minute, is to say our job is to help you evaluate the vendors and make sure that we've got you in place with the most appropriate vendor for you as of right now. You know, and what happens with Blue Cross is there's always trade-offs, and we talk about it all the time. They've got, you know, employees don't want to leave them, but yet they're expensive. And, you know, on the pharmaceutical side, they don't have what we talked about just briefly, which is that international sourcing or third party sourcing, or the fact that that we can get 100% of the rebates with a lot of the other vendors that we work with. Those are negatives to Blue Cross, but as you'll see when we get into evaluating the market, which we've listened to you all loud and clear this year, and we recognize that you want us to to work in your best interest, and that's why we're talking today. The pricing and what we've discovered with Blue Cross compared to some other market alternatives, we've not found anybody that is close to your pricing as where you're at right now. And we've turned over quite a few rocks to try to do that. So, that's just, and you're probably going to talk to that here in a bit, but that's all part of why we're talking here is thankfully we're in a good spot. We've got a surplus from last year. So far, we've got a pretty good surplus from this year. We're projecting, 5% on the budget increase, but that doesn't mean we're going to get a 5% increase from Blue Cross. That means that we'll have some surplus to carry over that we can carry over going into the future. What's happening with the stop loss market is, stop loss premium is expensive, and it's reflective of when we went to market and tried to find some. I mean, we've got a reinsurance carrier that we've done a lot of business with that we're trying to leverage into a more favorable play through this benefits captive. And we've got a lot of business with them as a company, and we do as an office too. But how much higher are they, Jess? Like 30% higher? Or?
Yeah, and we actually also at One Digital have a self-funded center of excellence that we've had out to market on your behalf. And essentially they will go to the stop loss market, the reinsurance carriers, to get a quote for you all to consider. And in going through that exercise, we've heard back from 8 out of 10 carriers that they went to, and 8 have declined to quote, essentially saying that their offer is at least 50% higher than your current arrangement with Blue Cross. So what we've continued to see when we do evaluate the market, especially on the stop loss, is that Blue Cross just continues to be very competitive in their stop loss pricing. So even if we see an increase on the stop loss with your renewal, we're likely still going to find that their pricing is the best out there. But we do have 2 other carriers we're waiting to hear back on. But if, the trend continues, as with the other 8 that we've already heard back from, the outcome might be the same.
Just for fun, walk back in time a little bit to that VERDA program again. Tell me how many employees that we have eligible for this, and is it a type 2 diabetes wellness program? That's what I had written. How many employees
Yes.
are eligible, and how many take part in it?
17 eligible, and nobody has engaged.
Okay, so have we advertised that at all? Okay, so we have a little, I guess, but we need to push harder on that on our end. How do we do that on our side to make employees aware? And then I want to tie this in on some of the first pages in how is it here? I think it might be page 1 or page 3. It says 91% of government employees believe their employer has a responsibility for their physical well-being, and only 36% feel that responsibility is currently being met. Is that our workforce, or is that just overall?
No, that's overall.
That's
Overall.
overall.
Yeah, that's overall. That's not.
Okay.
Yeah, there's room for misinterpretation there. I apologize that.
Well, that's all right. I just wondered because I'm like 17's eligible and 0 doing it, but
Yeah.
90% of people think it's our responsibility.
Yeah.
Boy, there's a gap if there's ever
Yeah.
one.
For sure.
How do we on our end, if type 2 diabetes is our highest, now where was that? is the single largest clinical cost driver in the first half of 2026. And if we have 17 eligible, 0 doing it, how do we change that on our end?
Yeah, it's just getting the word out there, and we're happy to, like I said, talk to employees at a meeting. I don't know if there's ever a universal time that you have employees gathering, or if you have an intranet, a company website, or a common area where individuals go to. We can certainly strategize and come up with maybe a co-branded flyer that talks about Verda, that has, Brown County as well as Blue Cross logo on there. But we can certainly strategize ways based on what you think will reach your members the easiest.
Okay. That's all I have. Thank you.
Mm-hmm.
I guess along that same line, how do we get the information to the employees that preventative care, helps the whole plan without telling people, hey, you need to do more about preventative care? Because that's a touchy subject.
Yeah.
I see, we have participation, and that's good, but how do we get the message out that getting increased participation in that can help the whole program and possibly even get us better coverage in the future?
Right. Yeah. Some employers do actually promote that their plan is self-funded, and I don't know if we've done that with the county before, if you all want individuals to know that. But I know that if we talk to the employees, during open enrollment, sometimes the talking points that we will have based on the employer's preference is based on it being a self-funded plan. The more you do, the cheaper we can get rates for you. It's hard when you all have an employee cost of $0, so at the employee only level, there's not as much skin in the game. But again, we do have employers that have a contribution required, and when individuals have to pay for their coverage, they might make better decisions. So there's some things that we strategize with employers on, whether it be altering the contribution strategy or talking to the employees at a meeting and promoting the preventive care, just letting them know, hey, yes, the county is able to pay the cost for you all now, but if costs continue to go up based on how the plan's being utilized or not utilized, that may not stay the same. So we can definitely talk about that based on direction from you all on what you would want us to communicate.
Since it's taxpayer money, are counties allowed to incentivize people doing preventative care? I know in the private market that happens, where they literally say, if you already do that, like how is that being done, Nikki? Okay, so because I know in the private market, that's the way that they're doing it. They're saying, if you want to do this, we'll give you some money. You don't have to do it, but if you do it, we'll. Right. So you guys obviously have monitored this a lot closer than this. Do you see that growing? Like more people wanting to do it? Only one. Wow.
We budget $2,000 for that.
Yeah. Wellness instead of Scable City. Okay.
There you go.
And only. Well.
Okay.
If I could just make a suggestion, I understand there's subsidization of certain types of drugs through Medicare and otherwise. I think that if you were to change, and I think this may be something that our insurance carriers our party claims administrators trying to suggest, and our insurance agents trying to suggest, that if you have a difference in price for employees that participate in wellness, i.e. the government is subsidizing part of your claim or your monthly liability, but if you don't participate and there's no subsidization, then with a $0, you're going to have zero incentive. But if you have a difference where, say, somebody owes $140, but if you participate in employee wellness, then you get half off. I think you're probably going to get 17 out of 17 participation. And then the question is going to be also, you want to drive type 2 diabetes. There's a couple of different things you can do. You know, you've got GLP-1s that work for a percentage of a population. I'm not a doctor. I give this without saying this at all. Okay, GLP-1s work for the vast majority of the population. I'm one of the 10 to 20% that they didn't work for. So I had gastric bypass surgery. I paid for that out of my pocket. That was a very intense life experience. It changes your perspective on everything. But I'm saying that, you know, if you're incentivizing people to make those types of hard life decisions, yeah, it's not necessarily a $70 or $100 thing, but most people that want to get more fit, you know, they're gonna take advantage of the drugs that they can if there's a subsidization event that happens to incentivize them. And for those of us that are looking towards a surgery, if there's some type of a subsidization there, then that's probably going to change. But if your type 2 diabetes is your primary driver, then you know you've got to try to incentivize people financially, I think, to do that. And you have a different cost structure, I think, in place that allows that to happen.
Okay.
So this next page here is some of these we've touched on as far as things that we've done since our last discussion, but did want to put this all together as far as what we've kind of been exploring, recognizing that we won't get your renewal till the first week of October. We have you know, again, looked at the Results RX option as the alternate drug list with Blue Cross. We also have gone out to the reinsurance market to determine pricing on the stop loss, and Blue Cross continues to be the most competitive option from that standpoint. As we get continued claims data, which again we get on a monthly basis, we can continue to share that data to the market to see if that helps. If they can see now we have, you know, 7 months of data, 8 months worth of data, and the claims are still trending well, then that can help improve any quoting that we can get on your behalf. Berkeley Captive is one of those options that we have evaluated. We can't get firm pricing until we have your renewal. So what we did is we asked for an alternate effective date, recognizing you likely won't want to move off of a 1/1 anniversary. We did want to at least get what pricing would be. So if you had moved 7/1 or 8/1 in order to get firm rates. And so what we did is we presented the data that we had available on your claims and utilization, your last renewal, things like that, in order to get a quote. So when we looked at a 7/1 effective date, we had 1 month less worth of data. At that point, we received a 45% overall above your current rates with Blue Cross. We then provided additional data through June, looked at an 8/1 effective date that improved terms a little bit to above 26%. And so, you know, essentially we are at a, you know, position where it's hard to compare, is that competitive or not compared to where you're going to be with Blue Cross until we get that renewal. But the captive is a strategy that we find if you're not going to be self-funded on a bundled arrangement with a carrier like you have today, that a captive arrangement is a long-term strategy that works well for employers. You're essentially looking at going in a captive with multiple employers. So you still have your same, you know, plan design that you want, the rates you set on your own based on your contribution strategy and the rates that we obtain for your group. So although you're going in with other employers, you can still be independent in how your claims or how your plan is designed. But what it does is it spreads out the risk amongst a larger population. So for an employer like yourself that, you know, it has about 60 lives or employee lives, that strategy can be helpful because larger employers, you tend to see when the risk is spread out more among more people, that when you have a large claim, it hurts a little less. So that's what this captive strategy presents, and one that we'll continue to evaluate as we get more claims data on your behalf. Before I move on to the next one, do you have questions about the captive?
I don't.
Okay, perfect. One other thing I'll mention on the captive, just for one of our employer partners that we support, who's been with a captive arrangement and they were previously with Blue Cross. They've been with the captive for 10, 12 years now, and on average, their renewal increase over that tenure of time has been a 5%. So, just to provide some background on how that strategy can be helpful in the long term. Amberwell, we know, has been something that you all have been in conversation. Oh, go ahead. Was there a question? Okay. Amberwell, we know, has been one of the options that you all have been considering in direct contracting with their group. So I have spoken with Dave over the last couple years a handful of times, and we did reconnect with him in I think it was last month, and we also spoke in February. And so we've continued to talk with him about options to consider with Amberwell and how the county can partner. They have started a direct-to-employer model with the Archdiocese. It is a new strategy that they've considered that became effective January 1. And so, I asked for a little bit of insight as far as how that arrangement's been going. But they are still working through that strategy and determining the logistics of it, but it sounds like it's been going well. They are not opening up a direct employer model for any other employer at this time, since it is something they want to get their footing with, except for if Brown County would like to participate. So they're intentionally limiting it to you all as well as the Archdiocese. We do have utilization reporting for your group that shows that Amberwell is already among the top providers that plan participants are seeing under Blue Cross's plan. And then the one thing that was disclosed was just that the CFO, who's been very involved in this type of model, the direct employer model, did resign. And so they're waiting for a new CFO to get up to speed with those types of discussions. Then lastly, the other option that we've kind of explored more recently is a reference-based pricing model. We know one of the things that are important to you all is trying to, least disruption as possible for your members, and that includes a network change. And what we've talked about in the past is that you can really only get the Blue Cross of Kansas network if you're with Blue Cross of Kansas. And so what we've done is we've tried to explore any other strategy that we can that would eliminate individuals feeling the disruption of going to maybe an Aetna or a Cigna, a different PPO network. And so with the reference-based pricing model, it's a self-funded strategy that can be used, that instead of using a traditional, PPO network model where there's negotiated rates, the plan sets a flat reimbursement level for services based on a percentage of Medicare. And so this is an open access model, meaning there's no network restrictions. Employees can see the providers that they're seeing today. And then this company that we would enlist to help with the plan, Pharos, they would then negotiate each claim directly with the provider as far as pricing goes. So it is something where it would be different than what you all have today. But again, it would eliminate individuals feeling like they need to, find a new provider if we were to move away from Blue Cross. If we evaluated this option further, we'd certainly look at coverage in your area as far as, where individuals are, currently seeking care and whether or not there would be what those relationships already are in place with Veros and Ocunet. But it sounds like they do have a lot of success with this model across Kansas. And so that would be something else we would want to present to you all.
Okay.
And I think that's it on the strategies. The next is, last we have is a 5-year roadmap. And this is essentially just, we feel like it's important that as a partner of yours that we're looking at a year-over-year strategy, not something that we're just looking to do in the current year and then, have to continue reevaluating year over year. So it's important to have a 5-year plan. And so what we've done here is we've essentially outlined our different, recommendations. This can certainly be altered and tailored however you see fit, but wanted to give you kind of a visual of what we would recommend in implementing something like this that we could work on together. And so, for example, in the first year, we would leverage that surplus, both what we carried over from last year as well as in the current year. We would consider the formulary change with Blue Cross, promote Virta, and then talk about whether or not we want to consider, the reference-based pricing, have additional discussions with Amberwell, and then go on to year 2. And what does that look like? So that's something that we would like to work on with you in year 2 as far as steerage. How can we get members to better utilize their plan? Are they going to use the plan effectively? We do have the musculoskeletal claims, so maybe perhaps we can evaluate a musculoskeletal program that we could implement to help target that cost towards your plan, as well as improve care for those members. And then we would continue on from there, with the idea being that we continue to improve year over year with what strategy that we are using, recognizing we may not want to do everything all at once and have a lot of change at once, sometimes taking it step by step as you feel comfortable. Sometimes that's best. So what other questions do you all have for us, and how can we further help you at this time?
Well, I think for myself, I'll speak first. These kind of meetings are great. I haven't been here very long, so I don't know how in the past how many times you did them, but for myself, it's almost like quarterly if I need it. And then I'm not saying you have to do it quarterly, but as you're watching the year progress, we want to be able to see where we are and what is trending.
Mm-hmm.
And then forecasting to me is super important. Being able to look forward and say, hey, we think this is where we're going to be next year or the year after that or whatever. It's really helpful for me.
Well, good. I'm glad to hear that. And we'll certainly meet you where you're at as far as frequency of the meetings. I mean, we'll meet with you quarterly, happy to go through the trends that we're seeing. And by all means, if we see a high claims month in between or something comes up that we think you need to be aware of, we'll make that information available in between.
Yeah. Well, I think the employees need communication from us, and we need communication from you, right? I mean, trends or things that we could do, possibly preventative health care, all those kind of things. We have to be able to communicate that out to the employees too. Understanding that we're not trying to force somebody to do something. We're trying to get them to understand what the whole plan looks like When you're provided healthcare, it's an absolutely wonderful benefit. But if all you know is it's provided and you don't understand how it works, then maybe you don't buy into it as much, like on a whole picture, if that makes sense.
Yeah, it sure does.
No, I don't have any questions. The one I had, I asked, and I see it's in the year number one box here, stabilize and optimize. And I think you mentioned it, that just since these objectives are in different years, it doesn't mean we couldn't accelerate. Like, I see a few things, in 2029, which, like a full chronic disease management program, diabetes, cardiovascular and autoimmune. I mean, things like that. I mean, why wouldn't you start now? So that's my only comment.
Yeah, we appreciate that.
Bill, do you have anything?
I think we just need to keep working on getting the employees on board and trying to be healthier.
Okay.
I mean, by using these options they have to learn more, be more educated and more.
We'll work on getting you some materials, and then you all can let us know if there's other ways that we can help. Again, an employee meeting, or once you see the materials, if there's anything that we can alter there, we can help however you see fit.
Okay, that's perfect. An hour goes by quick.
It does. Well, we appreciate you letting us have the time. It's been good to visit with you all.
Okay, well, thank you.
Thank you all.
Thank you.
Thank you all. Take care.
Thank you.
Bye-bye.
Okay. That's a lot. Do we have anything we want to talk about before we move on?
I guess, they were just highlighting that the last couple of years, there has been some carryover. And obviously that carryover is there. If we put it aside or we can get to it, it's so when we don't have a good year.
It's there.
So it doesn't affect our budget really harshly on the years that maybe employee, have more healthcare costs to be paying for. And that's the whole idea of doing that self-funded, is if you can have some good years, then when you have a bad year, you pay for it off your savings in the past, not out of that year's budget so much.
That should be put away in an expiring account or some kind of account.
So
It's in there somewhere. I was trying to find it.
No, I did the transfer. We have. But I don't know, I don't know the budget we have. That was used in the past. That was.
Hello, all.
hello.
Hey,
How are y'all doing?
we're doing well. Austin, we have our county appraiser in here. He's going to speak to us in about 3 minutes. So just
No
stay on
worries.
the agenda. So what's on your mind?
Not much. I just wanted to hang out in the background. My to-do lists are similar from last week. I listened to almost all of the insurance for the last 30-45 minutes. I thought it was a productive conversation. Still working through a number of things. I will be back in person next week. Got another meeting this evening with the board, so apologize I couldn't be there in person today, but I will be in person next week.
Okay.
Do you guys have anything that you want to talk with me right now about, or should I hang on through the appraiser, or what do you guys think?
Do you have anything?
Not in particular. I mean, obviously he's
Yeah.
He's
No,
right
you don't.
sometimes.
Nothing, no burning desire, nothing right on the edge that we need to
Okay.
discuss with you. So if we do, could I just reach out by phone?
Absolutely.
Okay.
Just
that's
call
what
or
we'll
text
do.
me and I'll rejoin. Okay.
All right. Thank you.
Thank you all.
Thank you.
Okay, just reading this, the governing body of Brown County hereby notifies, and it says plat. Is that right?
Oh,
Okay. It's all right.
yeah, that,
You see something else?
this part here.
Yeah.
Yeah.
That's all right. I bet we got that from a guy that was from back.
Nice to see you. Need to get that changed.
Jeez, yeah, should not. So Steve, why don't you just come on up? We're gonna round up to 2:30. You got other things to do, so. Welcome.
Each of you. And basically what I was going to talk to you today about was, in my economic plan going forward this year, one of the projects that I had was to, go through my land analysis. And, I had contacted Ryan Jansen from Equitable Solutions, a while back about the possibility of doing that. Getting us a different way or a different approach than what the state teaches in order to value our land. Hoping that would help us with some of our larger acreage parcels not going extremely high during, with the analysis that the state teaches. They basically teach us a straight line analysis where he has one that has price breaks in it, so that when you come up to a base, it's a certain price, and then over that it's a base. Well, the state teaches you that those are both one and the same. He's got an approach that the state has looked at, an approach, he's been doing it for a few years. And what that teaches is that after that break of your base value, that the increases are not as high. That they're tapered, and so it tempers the values on your larger acre parcels. That's just on market land. It wouldn't have anything to do with ag land at all. So the quote that he gave me was a couple of different options. The first being that he basically would do every bit of it from the start of the analysis right through the end of the narratives for the state. The second one would be that I do an analysis in-house and then hand off to him to review. And then he would do some testing and refinement and some suggestions based on what he sees in our models. My feeling, if I had my druthers, I would go with the first option just because it doesn't introduce any bias into anything that's going on and what he'd be looking at. And he could build us a model from the ground up that would be strictly based on what he's looking at and what he sees versus introducing what I believe I see in them. So that would be the two different approaches that you see there. He's kind of got a little bit of an overview as to what each option would entail. And then also he's got, like his conclusions and everything at the end of that. So that would be my suggestion would be option one, just for the mere fact that I would like it to be a much cleaner break from what we had been doing to what he's doing or what he would suggest doing. Did you have any questions on? Yeah, I mean, this may be something that you'd want to look over and.
We probably will.
Yeah.
I have a simple one. What's the appraiser's definition of market land? What does that term?
The market land is, I would have to look up and see what the state does. The way of looking at it is, it's anything that's not used for agricultural use. Agricultural use is kind of a broad definition as far as how it's used, because you can have something where, you have a piece of ground that is being planted, being dry crop. The stuff on the sides of it
that is probably more or less used for, what do you call it, buffering and, agricultural erosion, those types of things. And so that's also considered ag land. So it all rolls into one. It's where you start to get into the ones where we're looking at mixed use are going to be things like farm home sites where they may have a piece of it broken out that somebody's haying for them. Or it could be that somebody's actually planting part of their parcel. And so that you would draw a delineation between what is actually being used for ag and what's actually being used for residential.
Okay.
So that's where I'm kind of at as far as that goes. It's something that, the state has a couple of memorandums out about, at least one that I'm aware of, where they kind of define that a little more clearly.
So are you talking about going and looking at ground that in the past was considered all ag land and changing it to market land?
No, not anything like that. There are some parcels out there that, yes, we are looking at, but they are all recreational parcels. There's nothing on them that's agricultural.
What's the definition of a recreational parcel to you?
It's something that they're using for either hunting or, camping, or they're basically, one of them he has a trailer on the lower tip of it, and then the rest of it is all wooded land. He doesn't use it for cattle, nothing like that.
But doesn't he have the right to use it however he wants? He could put
Certainly.
cattle in there next month.
Certainly, he can do whatever he wants with it. And if he does put cattle on it, then we would look at reclassifying.
So in that model, if somebody has a piece of ground that they own,
Mhm.
and in one fall, they've got a camper out there, we're gonna reclassify it, and then the next fall, they decide to run cattle, we have to reclassify it again.
Well, we look at that in a 2-year cycle. We have to do our ag use analysis every 2 years. So I would defer to Nettie on that, on how she's doing it. I don't know if she does it all in 1 year, or whether she splits the county in half and does half 1 year, half the other, but either way, it satisfies the state's need for that reassessment. We would be looking at those, and yes, if they do have a change in what they're doing, then yeah, we would redo that as soon as we know we either see it or notify of it.
Is timber ag land?
No.
Harvestable timber?
No.
It's not.
To my knowledge, the state does not classify timberland as ag.
So right now, your classification of timber ground is market land?
If it's not part of another parcel that is ag. If it's part of another parcel that is ag, and it is and can be used for buffering or erosion control or waterways or things of that nature, then yeah. Then it's-
What I'm worried about is who defines how much of that is buffering and how much of it is not?
If we have a full parcel, chances are we're gonna leave the whole thing ag. If they're doing dry crop on part of it, and then they've got sort of an area around it, we're leaving that all as ag.
But that sounds subjective to me.
Well, I mean, if the other part of that is that I'm gonna go out there and part of their ag parcel as market land, and that's kind of been frowned on. That's kind of what one of the memorandums deals with. And, that could be, I mean, from what we do for our analysis, I'm not wanting to get that picky with things, because we're doing this just for the basis of taxation. And as long as I'm treating those parcels the same, then we treat everybody equally. That's what our goal is. And so if those parcels with the woodlands on them, they're ag, and it's a piece of it. If it's a full parcel, what all it is timber. And those people are just using it for hunting or whatever, they're not running cattle on it, then it would be considered market land.
So my problem with that is we're living in the Midwest where we have people leaving at a higher rate than people coming in.
Mhm.
Okay. And one of the things that the Midwest has seen a decline in over the years is the number of hunters coming to our area to hunt, which generate a lot of revenue.
So,
I mean, you go to South Dakota, a huge part of South Dakota's revenue is from hunters, people coming in.
right,
Back in the 80s, we used to see hunters coming in you know, every fall, and they stay in our hotels, they go to our restaurants, they buy our gas. If we start going in and saying, hey, if we think you're hunting on your ground, you're gonna get taxed more, that's going to further erode the amount of hunting that goes on in Brown County. And we should be attracting hunters here and bringing their money in to spend in our area, as opposed to doing something that would cause them to shy away, or landowners to say, I'm not gonna let anybody hunt on that, because the minute I start using it as hunting ground, I pay more taxes. I mean, that's a dangerous slope to go down, in my opinion.
Well, honestly, that's where the state is already. I mean, if you go county to county, that's how parcels are in other counties as well. And it's, I mean, and it's something that they watch. Because if you don't have something that's being ag use, then it can't qualify for ag use. In any way, shape, or form. So if I've got a parcel that's all wooded land. And they're not doing anything that's considered ag use, which, you know, would be either farming it or running cattle on it or something to that's that. Then it doesn't qualify for ag use.
So let me ask you this. You have 80 acres in Brown County. And right now it's mostly wooded and pasture and all that. And Brown County goes and says, we're going to tax you higher because we think that's market land or whatever. What's the breakout? What if that farmer goes and says, I'm going to break out 1 acre and I'm going to farm 1 acre? Does that bring it back into ag land? I mean, there has to be.
I mean, I would have to look at it. I mean, they're in, you know, you're talking about mixed use. If I was looking at it, I would basically, it depends on what is he doing with that 1 acre. I don't think he would be planting it.
Yeah. I just don't like the government telling people what they can or can't do with that 1 acre.
And we are in no way, shape, or form telling them they can't do anything for property.
What?
That's theirs to do with what they will.
Which one to value a timberland at higher value than ag land?
Yes,
Why?
because it's not ag use.
Is it,
It would not qualify for ag use because they don't have anything where they're either planting it, paying it, or running cattle on it.
The other problem with that, Stephen, we're having a discussion here. I'm not trying to argue with you. Okay. I wouldn't want to do something as a commissioner that would turn every bulldozer loose in the neighborhood saying, well, we can make that, we can fix that. We don't have timberland.
right?
I mean, that's a really bad road to go down. And I guarantee if we start punishing people because they have timber, that timber is going to be gone.
Well, and let me stop right there, because this in no way has any way, shape, or form anything to do with reclassifying land. This is just how do we value the land we already have, market land. This doesn't have anything to do with kind of going out and, you know, looking at a piece of land and saying, well, that's not ag, it's market. No, that's nothing to do with what we're looking to accomplish here. What we're looking to accomplish is a little bit more fair way of valuing higher end acreages. That's what I've gotten the biggest pushback through my appeals. Has been that higher acreages. Right now, they're high because of the way that we're taught to value land, at least by the state. This, I'm hoping, will introduce a new way that will allow us to not have those upper acreages go up as high as quickly, if that makes sense. So in other words, you got 100-acre tract, and let's say the base size for that area is 2 or 3 acres. It'll go up to a certain point to that 2 to 3 acre base, and then over that, it will not increase as much as it did below that. So that's what we're looking at doing here.
So I would just ask for clarification then on this proposal. Under the scope of work description for option 1, it says conduct land analysis for all acre and square foot models.
Right.
So to me, when I see land analysis, I think exactly what you told us it's not supposed to do.
No, land analysis is just basically looking at the calculations that we use to value the land. What we're looking at there, trying to think how the state, it's a use review is what I think what you're looking at, or what you're thinking that is. And a use review would be, what is the land actually being used for? And normally Nettie is doing that in a 2-year cycle, especially with all the ag use that's out there. Generally, your market land, we don't see changing use unless it sells and we see that they're doing something different with the land. And then it would go from market to ag, or if somebody was selling off a small piece of ag ground and somebody was bringing it into their residential parcel, that would change based on its use.
Okay, so just for. And fun's not the right word, just for discussion, if I have land that's ag use, I pretty well understand the tax, that use value appraisal, and that's how
Right.
we pay our tax. If it goes to market land, then we're paying based on the actual
The actual
value of the
fair market
land.
value.
And so what's the assessment on that?
You're looking at, if you're going from ag is at 25%. If you're going to a residential, it's 11.5%.
So it would go to
So-
residential, it'd be 11.5%.
Correct, correct.
So if I had, I'm just guessing, I think that Farm West or some of these rec farms are bringing, just say $6,000. I think that's close. That may be a little soft. So if 11.5%, Bill's doing his math.
We're fast.
Well, just say it's 600 and I think it's 660. I didn't know 11.5%. So does that mean I would take our levy times the 665 and that gets the tax? Is that correct? I take my appraisal
Okay, if you're doing 11.5%. Yeah.
times 11.5%.
It's, yeah, be the same formula. You would take whatever it's valued at
Yeah.
times whatever the assessment rate is, which are residential 11.5 times your mill levy would be your tax dollars.
Yeah, okay. So that gets pretty scary for recreational land.
It is, and that's one of the things that we're looking to address.
$609, yeah.
I didn't think it, but. All right, so, okay, so we're gonna need, I think we're gonna need to talk about this a little more.
I think that's fine.
Can this Equitable Solutions, can he give me, I mean, you said here, I wrote conduct land analysis for all that, and you said does not mean what land is actually being used for.
Right,
That's correct.
right, that's correct. That would be a use analysis.
That would be use analysis. Okay. And you made, I mean, of course, I never even thought about it, but if the intention of this is not to do a use analysis, is there a backdoor way to use this as use analysis? Because what he said is actually, I mean, we all own bulldozers and excavators and we can make trees go away pretty fast.
Right. I mean, as far as your farms go, that's not gonna change the use value or the use on the property.
Yeah.
Because we're still looking at it through the same eyes that we were before. It's that we're looking at how we're valuing it, and this would only be for market land, not ag land. Because ag land is one of those things that's set by the state and we do not have the authority to change it.
We got,
So you mentioned that Nettie, you would check with Nettie on one thing. Could Nettie come talk to us about this as well?
I mean, I don't think she's gonna be able to do this. What I would talk to her about is whether she's doing it in every year or splitting them apart and doing half the county this year, half the county next year.
and this
That's
is
not-
use analysis,
That
the
would be
2-year
use
cycle.
analysis, yeah, that would be, she's looking at the aerials that were taken, and I think if I remember right, the aerials that we use are called NAP and they are done every 2 years. And that's basically what she would look at and see, are there any changes from the previous
Sure,
aerial to
Sure.
this one?
okay, he's formulating the question.
So we say a wasteland, where's that going at?
Wasteland is something they have kind of wanted us to shy away from. It basically has to be that it is in a parcel where there is a lot of dry crop. And it's something that you could not drive machinery across, something to that effect, where you could not actually use it for anything else. Where a lot of people in the past were doing is they were doing the wooded lands as waste. A lot of counties went that way. I don't believe Brown County has ever been that way. So I think right now, as far as waste ground goes, we are in a very good position on that. I don't think that the state could say that we are abusing wasteland, categories. So,
I mean, if you've got a land full of rocks, that's pretty much, you can't farm it. I mean, if you aren't selling for hunting, I mean, what good is it? I mean, you
well,
can raise some of it, but.
in that respect, the soil types take a lot of that into account as far as the price of the land. That is built into those soil types.
But soil types, I mean, it varies from one field to the next, how many big rocks is, I mean, we've got a field that has rocks bigger than a state line.
Right.
I mean,
And that's an analysis that's done by the USDA. I believe, I'm not sure how often they redo that, but I know that they do that for K-State, and then they send down what the soil types are and where the delineations are.
But I kind of agree that you start. I don't know, just. So if you're going to do some of the land at market price, why don't you do all the land at market price? Why are we using ag land at a different rate than the other stuff? I mean,
Because that's what the Constitution says.
well, to me, that why property taxes are getting so out of hand is, in Topeka, they say, we're gonna tax this at this rate, this at this rate, we're not gonna tax this, or we're gonna do that. And so no wonder people get upset.
Yeah.
It's not,
And I mean, as far as that goes, I mean, you can thank special interests for that, the lobbyists, all of that stuff. Because they were the ones who lobbied hard enough to get those constitutional amendments put in. Where you've got all of these different assessment rates for the different properties. And then you have the ag lobbyists were the ones who were instrumental with the ag use values. So, if you're talking about doing it that way, there are states who do it that way. I'm not real sure how it works out for them. Because,
I mean, I'm not. Yeah, to me, it should be equal. So if you have your land that's timber, it's gotta be. Why isn't it use value too? I mean.
because the state of Kansas does not consider timber to be an ag crop. That would be my explanation for that. They would have to create something different to roll that in. And I'm not sure what they would do if they were going to do that. I mean, and they put in a different unique use or classification.
But historically, timber hasn't been market land either.
It depends on where, what parcel you're talking about and what its use is.
Right.
Because in Brown County, typically, if it's on a parcel where it's all woods and the owner is doing nothing ag, then it should be marketable. And we do have a lot of parcels that are that way. Like I said, there was a couple that I was referring or was going to be reassessing this year because we came across them.
So
Can I ask a question real quick?
Yeah.
So, sorry to cut you off. Did you budget for this in your
Yes.
budget? Where did you budget for? Because I'm looking through your Schedule C.
Yeah, that was part of the 5-year plan that you guys had asked for, was submitted here a few months ago. That was on my list to do this year.
I think that's all.
I'm gonna say, am I looking at something wrong here? Because I'm looking at capital outlay Schedule D, I don't see it.
Are you looking at pulling this project?
So the funds were already in capital fund.
So, I mean, that's what I'm looking at. I'm just looking at the capital and the sheets. Yeah. Okay. Well, we're going to talk about it a little bit more and we'll have some questions and again, I mean, if Equitable can give a little better scope of work description, if that's even, I mean, I still feel it's a little unnecessary.
Wanting to clarify that it's not a use analysis and just
I'm wanting to know if we spend $5, what does it do to the county? Where do we get the $5 back? I want to know what the benefit is. I'm using $5 as just a BS number.
Right.
What I'm getting at is you're asking two options here to spend a bunch of money, and I go back, like I said, I see where you're saying on the capital improvement sheet here for the appraiser, the 46,438.24. Guess what I'm asking is how come it's not in the capital outlay schedule D sheet on the budget here?
In 27 or 26, I don't know, I'd have to go back and look. He didn't make a line item is what he's saying, he wants to pull it out of his own. Is that correct?
Yes, it's being drawn from funds that are already there, not something that would be part of the active budget for 27.
Okay, well, I go along the lines that just because we have money in budgets doesn't mean we need to spend it either, so.
No, I mean, I understand that.
Okay.
I understand.
Okay,
I just, my personal feeling is this is just going to be a way that's going to help us value these parcels better. It's going to help. It's going to help with the taxpayers who have a larger parcel of land that is market value.
has he done this in other Kansas counties?
I believe I know he's done it with Lyon County. I'm not sure if he's done it for anyone else in this capacity.
If he's done it for Lyon County, can we see what that looks like?
Yeah, I can have him send something.
Just something,
Yeah.
overview, I don't know. Okay,
I mean, how much of that in depth do you want? 'Cause
I don't know, I think what we're trying to communicate here, and maybe we're just completely 180 degrees out of phase here, but there is I haven't gotten a super amount of comments from people, but one of that I do get is appraisals and, land values,
Mhm.
escalations and equitable solutions came up 4 or 5 years ago, I think, when you redid something across the entire county.
Yes, they did dwellings.
Okay.
Dwellings only.
Okay, and so that was a big deal, and if we end up doing business with that same company again, we're gonna get a lot of questions, and I want to be very super informed. So,
And I can probably get him to, draw up, what his overall goal would be.
Okay.
Where we are versus where we want to be,
okay,
and see what his conclusions that he can draw from that are.
and did I say that in a way that makes sense to you guys about?
You
being super knowledgeable? Okay.
You absolutely said what we all should be saying. We're the ones that get the questions and we don't want to say, I don't know.
Yeah.
Just like if we ask you something, I don't want to hear you want to talk to Nettie about it. I want to talk to you.
Right.
You understand?
Yeah.
Okay. So you're the manager.
Yes.
So we're the manager on the other side. And when people chew us out because they hear something,
Mhm.
I don't want to look at him and go, I think what he's trying to do is this. I want to know exactly.
Right.
So.
Right.
Bill,
Sounds to me not good,
it sounds what?
not good.
Not good, okay, okay.
I mean, the thing of it is, we can reject this out of hand. I mean, that's your other option.
Because timberland has value that you can't put dollars on.
Right.
I mean, and then you can put too much value on it,
Right.
really easy. I mean, it's really not very,
And that's exactly true.
for 50 years, it might not return you anything.
And that is a true statement, yeah. I mean, if you're going from a young forest, you're looking at least 50 to 75 years before it's mature enough to harvest.
And whether if it's not planted as certain varieties, it may not be worth anything.
That's correct. That is correct. The problem is here in Kansas, we do not have a way to value timberland. There has never been anything that's been done. And like you say, you're looking at a 50 to 75 year gap. And how much of how much value can you accrue from, 1 year to the next? There's never been any studies done on that, to my knowledge.
To me, it's,
But everything has a cause and effect too, Steve. So
Yeah.
I wouldn't want to vote for something that 10 years from now, we look back and say, you know why there's no timber in Brown County? Because the commissioners
Right.
did something in 2026 and every farmer went out there with their dozer
Right.
and they made sure they weren't going to pay $1 more in taxes. And they spent $10,000 not to spend $1 because that wouldn't happen.
understand that, and I will reiterate, this would have nothing to do with that portion of things at all. I mean, this is completely separate. It's not a use reevaluation. It is strictly how can we value these parcels better based on the feedback that we've gotten from taxpayers.
Okay, fair enough. I think we'll get some more information. We'll chew on it a while. We'll meet back up with you.
Yeah,
Okay.
and if you want, I can send those down for next week's meeting, and you can kind of go over them and then see what you feel.
Sure, I think that's fine. That's fine.
Okay.
All right. Anything else while you're here?
I think that's about it.
Okay, thank you.
Thank you.
You guys, appreciate your time.
All right. It's 3 o'clock. Everybody in good shape? All right. Let's get back on the agenda here. Sure. Okay, we have this notice of the revenue neutral intent. All right, so what I see here is the governing body of Brown County hereby notifies the Brown County Clerk of intent to exceed the revenue neutral rate, either yes or no, and we have a check mark by no. We do not plan to exceed the revenue neutral rate and will submit our budget to the county clerk on or before the 1st of October of this year. So I looked at our budget a lot. And I just messaged Scott Lloyd before I came here, and I mean, he just assures me that we are revenue neutral with the changes that we made, the adjustments that we made, and that any other changes we make in the general fund
We're gonna go cash.
So,
Yeah, so. Back to. Where we were. There was some numbers in that. Page you sent to us that's on there that didn't agree with what I had on our budget.
which numbers were those?
Well, like conservation was one, direct election was another.
Yeah.
What?
Are you just looking at the one page?
Yeah. Why not? I mean, explain.
The matchup reports. And we did reflect.
Okay, because some of those numbers were higher than what, I mean, not, couldn't pick it up.
But Scott mentioned that when we talked to him about it before.
Okay,
Yeah.
so. Yeah. This,
Are you talking about this sheet? Uh-huh. Yeah. Because like conservation. Did they ask for 29 off the top of my head?
28 or wasn't it?
28.
Or no. Yeah, conservation, they were only asking, yeah, for 28 and. On here, then.
28,966.
Yeah. So, but let's cover this one.
Yeah. So I agree. I wish those numbers were smooth and clean, but somewhere in this process, they get a little fuzzy.
Right. So we stay below revenue neutral.
Yeah. If I had, we just talked to the man about wanting to be super knowledgeable about things.
Mhm.
When I'm here with Scott Lloyd, he'll explain this to me, and then for the next day or so, I can explain it back.
Right.
And when time goes by, just like Bill said, and we're not picking on conservation, but they're an easy one. So they asked for $28,000 even. And so here in the proposed budget year for 27, it shows a 28,966. Now I understand the budget authority for expenditures because that has their unencumbered cash back into.
Right.
The 966, I confess.
But that came up and he explained, and the difference is I believe what he's saying. I'm trusting what he's saying.
Uh-huh.
And so since this is the first budget for me, there's lots of things in here that are not as concrete as I'd like them to be. And I'm assuming that next year, if I'm around, next year, those kind of questions will kind of reveal themselves and we'll understand it a little bit more. I'm trusting that Scott's telling us the truth on it. And I believe I'm not saying he is, I'm just saying that,
So is this page what's gonna be published in the paper? So if the conservation people know that they just asked for 28 and we got 29 in here. What kind of question is that gonna raise?
Budget in that other page where was,
They'll show the 28 there.
and then when they get the check, she had those improved. And it goes up to not over. So. Yeah, it does time on gate and not over.
and I guess the best way to do that is we could ask Scott to like email us a simplified explanation of that we could send out to each one of these, agencies. Talks about the discrepancy between what they're asking and what's showing. And I think that might be a good thing to do.
I mean, that they weren't all, some of them were the same, that's what we had. I'm not questioning his work necessarily, but. I mean, CPAs have made mistakes before.
But that's just, so we could probably go over this and figure this out if we wanted to. I mean, he shows it here in the sheet we had when he was here on the 9th. And it shows our cash reserve and it shows the budget authority amount and the tax required. And it all matches up with the budget sheet or the publication sheet that we have in front of us.
Like I said, that question was brought up and he explained it. We could probably call him on the phone right now if you.
He was at a meeting in another county.
Okay. So you're saying that other counties are more important than us then?
I think just not saying anything.
I don't want to cause trouble.
No, you're not causing trouble. You're basically bringing it up again in like.
And I should have probably already know the answer to this.
So. And you said, Nikki, he added a delinquency rate on the publication sheet. Does it show there by chance?
Okay, so. So the tax required is 28,966. And a part of that's not paid. Then that would take it back down.
28,000, plus you need to remove the $694 for the neighborhood revitalization.
Right, and things like that.
And so that gets it down, and if the delinquency rate is say 1%, that would be $289 or so. It must be less than that. I don't see it on the publication sheet here. Or in the number. Was it 1.5?
Anyways. So the tax collector has to be more than what they're paid because not everybody pays it and there's some of it's.
Correct.
Yep.
So that. But then you go down to.
Yeah, let's do this.
Anyway. Okay.
All right. Well,
Sorry.
Don't be sorry. It's a good question. And again, numbers, margin of error is. Okay, at this point, are you comfortable moving forward on the notice to not exceed the revenue neutral rate?
Yes.
Okay, so I have this in front of me, the notice, and we've got the box check. No, we do not plan to exceed it. Okay, so who wants to make a motion then to I guess, sign this notice of revenue neutral rate intent? Meet on August 31st, 2026 at 2 o'clock courthouse. Okay, so we would make a motion then to sign this notice of revenue neutral rate intent and set the budget hearing meeting for August 31st at 2 o'clock here at the courthouse. So would you amend your motion to include the meeting time?
I would.
All right, so there's the amended motion. Is there a second?
I'll second.
It's been moved and seconded. Is there any discussion? If not, all in favor, say aye.
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 Okay, motion carried. Okay. That's good deal. So I can sign that, right? I'll ask later. Okay, item number 3 is the solid waste lease purchase information in regards to the backhoe. I had, was Brandon able to come up with any other options that he sent you as far as that? No, he didn't. Okay. Okay, so we've got a couple of different options here on that 2022 backhoe with 880 hours. So did you guys take a look at these?
Tell me again what the price was. That was 85,000.
It's 85. There was 3 different units that he had got prices on, and we were going with the lower.
Right. No.
Oh, yeah. So looking at the financing options from local banks.
So what the landfill have in their capital improvement or whatever?
60 some thousand, I believe.
How much? 50?
Yeah, I'm trying to get, I'm gonna get my screen on his backhoe quotes. If somebody else wants to go to capital improvement, we can have that up. That's top of my head, it was in the 60s.
Okay, so I guess my thought is when you get it paid off for the spot.
Okay.
That we can afford.
So you're looking at a 2022 with 880 hours, is warranty eligible, delivered is 85 full. And so on and so forth. Now, we haven't addressed the road or the solid tires.
So because it's a case, the solid tires should be able to be switched over from the other unit that we have out there. I think what we haven't addressed is what we're doing with the unit that he currently has.
My understanding was, did he not want his reserve to have solid tires?
Yeah, he's gonna want his reserve to have solid tires, but I'm just. We don't have any quotes on that, so I don't know how to.
That's another expense. The front tires they just bought were a couple $1,000 or something, right?
Yeah.
Like a piece, or was that for that?
I don't remember, Bill, but
I think it was for the set. I mean,
I'd assume you'd have to buy wheels too. You're not just buying.
Yeah,
Yeah,
because the solid rubber tires come with the wheels.
The whole set, yeah, okay. All right.
so I have to run for that too.
Forgive me, I've never bought a set of solid rubber tires. So. Okay, do we need that? Do you need that machine information anymore? It's just.
So you said you had three quotes.
Yep.
What? The one
There was
company-
a 590, which we do not need.
One we were looking
And
at.
what was the 590 price?
There's a 590. I got a 580 of 2021, 580 super in at 89 or at 91.5.
He also had a quote for a 590, which I called him about, and we discussed that we don't need the extra horsepower
That
for
was,
what he does.
right,
Let's see.
yeah. Anyway, it was the one that had what 1,600 hours or something. No, 880 hours.
880 hours.
Okay.
Do that.
So at this point, the only other thing is, do we know that if that unit's still available? That's the only one problem I see here. I mean, we could move forward and say, yes, we would use this. You know, decide on the bank that we're gonna use for financing, decide on the term and all that. With the understanding that that unit may be gone now. And if that happens, we'd have to get more quotes again, but then at least we kind of know the avenue we're gonna go with financing,
You have no idea what the plan could be.
so. So the only other thing, Bill, is we're deciding on length of term. So it appears that the first option bank would be the lowest.
You're right. People, are you thinking a 5-year payout, a payback?
Hmm?
It'd be ready to go in 5 years. Yeah, it'd be ready to be traded off. Um. Okay,
I'm just talking about pure interest rate.
pure interest, right?
Yeah. So. Which doesn't mean that we save any money by any means. If the unit doesn't last the 5 years, that's the biggest problem. I personally I don't think that. With the number of hours that they're putting on that machine, I don't think we'd have it in 5 years.
3 years.
Yeah. So we'd be looking at something like a 3 or a 4-year term before the thing's worn out.
And then we need to figure out too, that warranty eligible, we need to figure out what that warranty would cost, because that might be pretty valuable. All right, let me see here.
Well,
Solid waste is $60,775. Yeah.
say it again, $60.
$60,775 in their capital improvement as of the end of May. And he's got the backhoe in there under his capital outlay already. 75,000.
So the last option here gives us a chance to. He's got money to put money down.
Yeah.
Okay, and also takes us to a 3-year lease. Which fits more along the lines of the number of hours we're gonna be using on that backhoe per year.
Yeah.
We're putting on a rate right now about it seems like about 1,800 a year.
Yeah.
I think so, when I was looking at it before.
Makes sense. All right. Any prepay? No prepayment penalties.
No, not on the last option.
I'm gonna try to find. Should be released.
I mean, none of the quotes are apples for apples. That's not a bad thing. It's just that, you know. Some are willing to loan on the full amount, it looks like, which I think we need to put money down on. I think we need to pull that cost down immediately. And he could take that out of his fund. He's got the money. I also think the 3 years puts us right there along the lines of where the thing's gonna be.
So we didn't,
Needing to be replaced.
so when we did our solid waste budget too, that 75,000 in there for capital outlay, for the back level. I mean, that's in our budget for next year. So
It returns the cash too.
it would, I mean, we still want to spend it right, but we've got our figures set, figuring on spending 75 grand next year on back.
Right. So I think this improves that. I mean, that
Yeah.
sets the benchmark, and I think we beat the benchmark by going this way.
No, I agree. I think we just decide on what we want to spend on the down payment. I would look at doing a 3-year payback also to keep it more in line with the life of the machine. And
Their interest rate is the same too, though. I mean, that's two of them have the lower interest rate than the other. So all I'm getting at is the 4.9% interest rate is.
that's middle of the road. There was a 5.3, a 4.72, and a 4.95. But it's. Nikki, when you asked the banks, did you ask them for a term, or is that just what they came back with?
Exactly. One of them, I believe, I can be involved.
Okay,
Because we basically said, what would they be willing to do on a used piece of equipment? That's the whole deal is. And so you can see that the lending institutions all have their own, obviously they're wanting some skin in the game right out of the gate to feel comfortable with it. And I think we do that anyway.
yeah, absolutely. All right.
My vote would be for the last option here. Taking money out of his fund to do the down payment. And then understanding that we're gonna try to get the 3 years out of that machine before we're looking at rolling into some other machine within 3 years, 3 to 4 years.
So do you want to stick with the 80% to 20% down, or do you want to play with that a little bit too, to get the payment?
Well, there's no prepayment penalties,
Right, so we can pay it off anytime.
so we could pay it off. We can play with that on our own budget over the next couple of years. I mean, we could literally.
Pay them whatever we want.
We could.
We have 61,000 in that fund. I mean, is it important to you to protect as much of that as you can?
Like to, just
You
because
want to
I
protect it?
don't know what else is gonna come up as far as.
And so
And don't forget in that, the budget we're talking about, we're already overexpending a little bit because of the extra employee we have out there. And I'm thinking there's gonna be a shortfall on that, plus we experienced several months of higher fuel costs than we anticipated, and I think that's gonna, at the end of the year, it's gonna come to fruition, so.
Okay, so then we're looking at an option with the Citizen State, for 3 years at 4.95% with a 20% down payment. That's of the options we solicited, that's the one you gentlemen like the best. And so I guess if we wanna, I would just make a motion to pursue this machine, and if it's still there.
Yep, and then if the machine's not there, we'll go back right into that same looking what's out there, knowing what kind of options we are available at this time.
Okay, so
So 80%. This, so you gotta pay this much off
17 and some change, yeah.
to start with. And then
And payment will be 20.
that's four more payments of 7. So that's only have 3, so we'd be able to be about 22 or 23. Next payment would be 22.
Okay,
So 5.
all right, so. Trying to make this motion here because we got two different things. We're interested, we've decided we're interested in the machine. Did you have any pop up that was close? No, any other supplier? Okay, so we solicited bids. We've done that. We've solicited bids for financing. We've done that. So do I combine the motion and say we approve? I guess I would call for a motion, or I'll just make the motion that we attempt, provided it's still there, in this 2022 580 backhoe for a purchase price of was it cost there 85,000? Pardon me.
It was 85,000.
$85,443 delivered. And we finance it with Citizen State Bank, the terms they provided, which was a 3-year lease. with 20% down. So I'll make that in the form of a motion. Is there a second?
I'll second.
Okay, it's been moved and seconded. Is there any discussion?
None. I was just gonna say that after we accept that, I was just gonna make sure that if anybody's watching and they're wondering what we're doing, we had a price of a brand new backhoe at $155,000. Okay,
That's true.
and in lieu of spending $155,000 on a brand new backhoe, we were able to search and find a used backhoe with low hours that will suffice and do the job that we needed to do at the landfill for $85,000. We went out into local banks, got financing. We're happy with the financing. The end result is we're saving the taxpayers money, we believe. As long as that backhoe continues to fulfill its need for the next 3 years, we will save money.
Okay. And we still have the right to, we still want to pursue the warranty on the thing.
Sure.
And if we do that, we can pull that money out of the capital improvement fund if we need to add up to. Is that correct? All right. So there's a motion on the table. We're still talking about it. Bill, do you have anything you want to say? Okay. Well, then all in favor, say aye.
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 Okay, motion carried. Who wants to pursue that? You want me to call Brandon and tell him to get on the horn?
That'd be fine.
Okay. And we had somebody sneak in. You need to talk to us?
Real quick.
Come on in.
Back. No, we just had the turbo go out on the rescue squad truck. We just had a little water rescue deal down at Horton. Car went off in the creek. So the rescue squad truck being drove back to under that. So we had to put the Suburban in service and the tires in there 14 years old. So we gave it, we're just gonna have to be swap out the tires on tomorrow. We're gonna have to use it for another week here. Depending on how long it's gonna take to get this turbo back in, so. I just wanted to let you guys know this.
Okay.
We're gonna put some new tires on it, because it's, yeah. We pulled it out with this heat, if we blow one out, people somebody wrecked that truck.
We'll be sending the rescue squad to rescue the rescue squad.
Yes.
Yeah.
So, price of tires both places. And Christmas place down there the cheapest. So, yeah. But I just wanted to, you guys heads up on that. We'll go ahead and get it done, yeah, take a check.
They understand.
So, yeah, that's all I have.
That's it?
I'll give you guys a heads up.
Okay, I was listening. You tires on the Suburban. They're 14 years old.
So, and we're hoping the turbo is under warranty. We're supposed to be checking. Find out if it's.
How did it go out? Just did.
This is the third time that they've done it. I don't know if it's just the one of them, we got a lemon or what, but. So, might just have to look at doing the upgrade on it. It's only got 7,000 miles, but the warranty's out there. It's gone now anyway, so whatever we do with the motor, doesn't matter if it's out of warranty.
How new is that truck?
What we need,
17. Okay.
so 5 years stuff
Sure,
out,
sure.
50,000 doesn't matter if it's 5 years gone. So,
And then one camo.
it's only got like 7,200 miles on it. But it's at 6.7 and then, I mean, it just keeps going these turbos. Anyone going that fast, and actually, I don't want to run off, go across the little bridge or well, something like that. So, yeah, Simon picked them up, but I was down there and I picked them up on the way back. We left it down in the shop in Horton,
It's never dull.
go back. So, yeah, we got what we could out of it, left it down there for them to grab it. All back. So,
Sounds fun. Thank you.
Who drives that truck? Is it one driver or is it?
just different people, but, yeah, but yeah, it's one of the deals. I think it's, doesn't get drilled that often when it does, or, 75 mile an hour, or whatever it is, so it's. Yeah, but we might start just trying to take it out and drive it a little more, even once a week, take it around, let the leave or something, just to. Move it around from like this. You might sit there for 3 weeks, not go anywhere, and then jump in and take off.
Yeah.
Might start driving a little more. So,
Okay.
Have you been talking to Ryan about this?
yeah.
Okay, would you let him know that we're in a meeting? Because he called and I think that's probably what it was
That's
about.
what it's about. So I told him I just come up and talk to you real
Right.
quick, because we want to just make sure we get those on the spur and back, ready to go, so we're not. Have an excuse if we get a tire that's blows out or something, if we're gonna I mean, it's gonna take a little while, even if he gets it right in, it's gonna be 3 or 4 days before I have to turn on and switch it out.
Okay.
Just wanted to give you a heads up.
All right, thank you.
All right, thank you.
Next time you address this, could you bring us good news?
Sure.
Okay, thank you. Appreciate it.
All right, is there any other business to come before us before we adjourn and have a short little work session? You need 5 minutes for non-elected personnel, performance and duties with the commissioners and you. I'll make that motion. Is there a second?
Second.
It's been moved and seconded. All in favor, say aye.
I'm
Aye. Aye. Yeah, motion carried. 5 minutes, puts it about 3:35. All right, we're out of executive session, back into regular, with no binding action taken. However, I will make a motion to go back into executive session with the same people for the same reason for 5 more minutes. Is there a second? Been moved and seconded. All in favor, say aye.
Aye.
Aye. Aye. Okay, motion carried. 5 more minutes puts it at 3:40 or so. Okay, so we are out of, excuse me, we're out of executive session, back into regular with no binding action taken. We're gonna move on here. I'm attempting to contact our solid waste director about the backhoe and other things. So I'm gonna call him again. He'll probably answer. Anything else you want to talk about? Hey, Brandon, it's Lucas. Okay, you got 10 minutes for us? 10. Can you talk to us for 10 minutes, Brandon? Okay, well, okay, I'm gonna make a motion to go into executive session with you, with our solid waste director, the commissions, and our county clerk for 10 minutes to discuss non-elected personnel and duties. Is there a second?
Second,
Okay, it's been moved and seconded. All in favor, say aye.
I.
Aye. Okay, motion carried. All right, Brandon, I got you on speakerphone. Okay, we're out of executive session, back into regular with no binding action taken. I have our solid waste director, Brandon Rader, on the phone. Brandon, we approved I guess the purchase of this 2022 Case 580N backhoe with equipment share out of anyway. And so we wanted the quotes you gave us, the contact information you gave us, we'd like you to go ahead and reach out to them to I guess.
Find out what the final best offer is.
Yeah, final and best offer.
If you could, just let them know that we're very interested, but we've got other options and we want to know what his best and final offer is and see if he comes back with anything different.
Okay, I can do that.
Okay?
All right, and let us know as soon as possible, okay?
Yes, I will.
All right. Is there anything else for Mr. Rader? Okay,
I don't have anything.
okay, right on. Well, you make the call, let us know how it turns out and get in touch with Nikki about getting on the agenda for Monday.
I'll do it.
Okay, thanks, man.
Thank you.
Bye.
Thank you.
Pretty well. Okay. Moving on. Okay, is there any other business?
So my other business, we've already addressed, with the invoicing. I guess that'll come up at Monday's meeting.
Okay.
I think that was it for me.
All right. Well, it's almost 4 o'clock. Do we want, we got,
So what all this about?
I was just on the table, on the desk. Was that not for you? That must have got left here by accident. I didn't see your name on there, so I think you're the one. All right. Okay, so we do have a short work session scheduled. We'll make it super short because we need to close the day out at the courthouse and it got to be 4 o'clock pretty fast. So we don't have a work session Thursday. Is that correct?
Correct.
And we will meet again on Monday.
Correct.
And we have a work session next Thursday. No, we got 2 meetings. Okay. All right. So by signing our revenue neutral, we've done what we needed to do as far as the budget timeline and we have until the 1st of October to finalize everything else. So we should be in great shape. So if there's no other business to come before the commission, I would ask for a motion to adjourn and slip into our work session. Okay, is there a second?
I'll second
It's
it.
been moved and seconded. Is there any discussion? Not all in favor, say aye.
Aye.
Aye. Okay, meeting adjourned. I'm gonna go fill my water cup up and I'll be right back.